Coming up now, it's been nearly 3 weeks since Ascension Seton Hospitals had a ransomware attack. As a result, computer systems are still down, and officials say they're working hard to get it resolved. Ascension said, quote, it continues to work around the clock with industry-leading cybersecurity experts to safely restore operations across the network. And joining us is Chris Nottingham from Checkpoint Software. It's a global provider of cybersecurity software and threat prevention solutions. Chris, thank you so much for being here with us this afternoon.
Great to be here.
So let's start with this. Your organization has helped several other organizations recover from cyber attacks. You did find that the healthcare industry is a common target for cyber criminals. What makes hospitals so incredibly vulnerable?
Healthcare systems are really the trifecta in terms of what criminals are looking for for organizations to attack. They've got lots of valuable information, the patient health information, insurance information, et cetera. They're open 24 hours a day, 7 days a week. So downtime is really important to them. So any kind of outage that can be impacted makes them more willing to pay. And the third piece is hospital systems are chronically under-resourced on cybersecurity. So they have really come out to be one of the leading targets for cyber criminals.
So, Chris, you just talked about the resources, or really lack thereof. These incidents can really impact billing as well as surgeries and much more. So how can hospitals safeguard patient data before and after a hack?
I think some of the guidance that's come out from CISA, from the government, has been very helpful. Some of the resources that they've put toward helping out healthcare systems get ahead of these attacks. In general, though, healthcare organizations are primarily focused on patient care, and bringing cybersecurity up in the terms of priorities has been something that's been very slow.
And then can you talk about just really the cost implications of all of this?
So in terms of cost, based on what we've seen, the average cost to the hospital system to remediate from an incident like this is over $10 million at this point. It's a tremendous cost to the organization, just in terms of the dollars it takes to get running again. And that doesn't even count the impact to patients while systems are down.
And then can you talk about the timeline? How long does it take for a hospital to recover from something like this?
Depending on the size of the organization, it could be weeks or months before they're fully recovered from the attack, depending on how well their backup systems are, how often they have gone through that process and are familiar with what it takes to fully restore those systems after they've been compromised.
Okay, Chris Nottingham from Checkpoint, thank you so much for being with us.
Thank you.
First warning weather with meteorologist